What if I told you that most people are measuring their blood sugar completely wrong? These 13 critical mistakes could be giving you false readings and putting your health at serious risk. Stay tuned because what I'm about to reveal might shock you. Welcome to my YouTube channel. I'm Dr. Thomas. Today we're diving deep into the world of blood glucose monitoring. Whether you're dealing with prediabetes, managing type 2 diabetes, or simply want to optimize your metabolic health, this video will change everything you thought you knew about testing blood sugar. Understanding blood sugar basics, let me start with something that will blow your mind. Right now, circulating through your entire bloodstream, there should be just 1 teaspoon of glucose. That's it, one single teaspoon. Your body maintains this incredibly tight regulation because excess sugar in your blood is actually dangerous. Here's where it gets interesting. When someone develops prediabetes, that amount climbs to about 1.5 teaspoons, and full-blown diabetes. Just 2 teaspoons total. Think about that for a moment. The difference between perfect health and diabetes is literally 1 teaspoon of sugar in your entire blood supply. Now you're probably wondering, but Dr. Thomas, don't people eat way more sugar than that? Absolutely. The average person consumes anywhere from 52 over 100 teaspoons of sugar daily when you account for hidden sugars in starches and processed foods. Bread, pasta, rice, these all break down into sugar. So how can someone eat 100 teaspoons but only show 2 teaspoons in their bloodstream? The answer is insulin. Think of insulin as a powerful vacuum cleaner constantly working overtime to remove excess glucose from your blood. It stores this sugar as fat, converts it to glycogen in your liver and muscles, and works tirelessly to keep your blood levels from skyrocketing. The insulin resistance problem here's what most doctors won't tell you. They focus almost exclusively on blood sugar levels, but they rarely test insulin levels. And that's a massive oversight. If they checked insulin, they'd discover it's often dangerously elevated long before blood sugar starts climbing. The body doesn't like excess insulin any more than it likes excess sugar. When you consistently consume high amounts of carbohydrates and snack frequently, your cells start developing insulin resistance. It's like knocking on a door so many times that eventually nobody answers anymore. Your cells stop responding to insulin's signal to absorb glucose. This insulin resistance is the root cause of type 2 diabetes, and it is also linked to dementia and Alzheimer's disease, which researchers now call type 3 diabetes because it is fundamentally a glucose metabolism problem in the brain. Here's another fascinating fact. When someone has diabetes, roughly 80% of their blood sugar is actually manufactured by the liver, not consumed through food. Only 20% comes from their diet. The liver has gone haywire, producing excessive glucose because the metabolic signals are completely confused. This is exactly why metformin, the most common diabetes medication, works by telling the liver to stop making so much sugar. The medical approach vs reversal, the conventional medical system waits until you're fully diabetic before intervening with medication. They're focused on managing symptoms, not addressing the root cause. And surprisingly, 95% of physicians actually discourage low-carbohydrate diets due to misinformation and outdated nutritional dogma. Instead, patients receive medication and are told to eat glucose tablets or candy if their blood sugar drops too low. Many doctors are more concerned about hypoglycemia, blood sugar around 70 milligrams per deciliter, than they are about consistently elevated levels. But here is the truth. If you train your body to run on fat and ketones instead of constantly depending on glucose, you can comfortably maintain blood sugar levels of 60 or even lower without any hypoglycemic symptoms. Your body becomes metabolically flexible. The 13 critical testing mistakes. Now let's get into the main content. The 13 mistakes people make when checking their blood glucose. Mistake number 1. Testing with dirty hands. Imagine cutting an apple or touching any food before testing. Those sugar residues on your fingers will mix with your blood sample and create a false reading called pseudohypoglycemia. Always wash your hands thoroughly with soap and water, then dry them completely before testing. This simple step eliminates contamination. Mistake number 2. Testing with wet alcohol wipes. After using an alcohol prep pad, many people immediately prick their finger while the alcohol is still wet. This can artificially raise your reading by 10 to 40 points. Wait at least 30 seconds for the alcohol to fully evaporate. Also, avoid alcohol wipes containing glycerin, which is sweet and can skew results. Mistake number 3. Using expired test strips. Test strips have expiration dates for a reason. Chemical reactions degrade over time, leading to inaccurate measurements. Always check the expiration date and store strips according to package instructions. Mistake number 4. Temperature extremes. Exposure to extreme temperatures, whether from a hot sauna or a cold plunge, can alter your readings by up to 30 points in either direction. Keep your test strips at room temperature and test your blood sugar when your body is at normal temperature, not immediately after temperature exposure. Mistake number 5. Medications and supplements affecting readings. Tylenol and high-dose vitamin C can increase blood sugar readings by 30 to 50 points. If you're doing a fasting morning test, skip all supplements and medications until after you've measured your glucose. Even coffee should wait. Mistake number 6. Squeezing your finger when you milk or squeeze your finger to get more blood. You're forcing interstitial fluid to mix with blood, which dilutes the sample and can drop your reading by up to 30 points. Instead, let the blood form naturally with gentle pressure, then allow the test strip to draw it in. Mistake number 7. Using different fingers can give you varying results. For consistency, stick to your middle or ring finger for all tests. Other fingers may have different blood flow patterns that affect accuracy. Mistake number 8. Continuous glucose monitors vs finger pricks. Continuous glucose monitors measure interstitial fluid, not blood directly, which creates a lag time of 10 to 15 minutes, compared to finger prick tests. If you test right after eating, the CGM will show delayed results. Additionally, sleeping on your CGM can create pressure that affects morning readings. Mistake number 9. Testing at high altitudes. If you're at elevations around 10,000 feet or higher, reduced oxygen levels can throw off your readings. Be aware of this if you travel to mountainous regions. Mistake number 10. Timing your post-meal tests incorrectly. For accurate postprandial readings, test between 1 and 2 hours after eating, not before, not after. Consistency and timing is crucial for tracking patterns. Mistake number 11. Coffee before testing. Caffeine stimulates adrenaline and cortisol release, which can trigger your liver to produce more glucose, raising your reading by up to 20 points. Save your morning coffee until after you've tested. Mistake number 12. The dawn phenomenon. You wake up, haven't eaten for 12 hours, yet your blood sugar is elevated. This is called the dawn phenomenon. Around 6 a.m., your body experiences a natural cortisol spike that can raise blood glucose. More importantly, if you have liver insulin resistance, your liver acts like a sugar factory overnight, pumping out glucose. This improves as you address insulin resistance, but it can take several months to normalize. Mistake number 13. Dehydration. Insufficient water and electrolytes can alter blood sugar readings by 10 to 15 points. Make sure you're properly hydrated with adequate water, salt, potassium, and magnesium before testing. Understanding A1C tests. The A1C test measures your average blood sugar over 3 months by checking how much glucose attaches to your hemoglobin. However, this test has variables too. Different ethnic backgrounds have slightly different red blood cell lifespans. Asian, African American, and Hispanic individuals have red blood cells that live longer than Caucasian red blood cells, which can result in slightly higher A1C readings that are still normal for them. Anemia can also skew A1C results, and interestingly, following a low-carb ketogenic diet causes red blood cells to live longer, which can also affect your A1C. Keep these factors in mind when interpreting results. How to reverse type 2 diabetes. Here is the truth that the medical establishment doesn't emphasize enough. Reversing type 2 diabetes is remarkably straightforward. It takes time and commitment, but it's absolutely achievable. The liver is central to diabetes. When it becomes fatty and insulin resistant, it drives the entire disease process. The incredible news is that your liver responds rapidly to carbohydrate restriction. Within just weeks of following a low-carb diet, you can eliminate at least 50% of liver fat. The solution is a ketogenic diet combined with intermittent fasting. Why intermittent fasting? Because it's not just what you eat, it's how often you eat. Every meal triggers an insulin response. By eating 2 meals daily or even 1 meal daily, you dramatically reduce insulin spikes while keeping carbohydrates low. Many people reverse their diabetes in as little as 10 weeks. Some take longer, but the results are consistent and scientifically documented. Research from organizations like Virta Health demonstrates real reversal. Not just management, accelerating your results. Want to speed up the process? Add these strategies. Regular, consistent exercise burns glucose and improves insulin sensitivity. 1 tablespoon of apple cider vinegar diluted in water before meals helps moderate blood sugar spikes. If your morning glucose is elevated, take a walk to burn off that excess sugar. Berberine is a natural compound that works similarly to metformin without the side effects. Quality sleep, stress management, and adequate sunlight exposure all play crucial roles in metabolic health. If you found this information valuable, I've created a comprehensive guide on implementing the ketogenic diet correctly. It's essential viewing for anyone serious about reversing diabetes or optimizing their metabolic health. You'll find that video linked on your screen right now. Don't forget to subscribe to this channel for more evidence-based health insights that can transform your life. Hit that notification bell so you never miss crucial information that could save your health. Remember, you have more control over your metabolic health than you've been led to believe. Take action today, and I'll see you in the next video.